Good afternoon, everyone. Can folks hear me okay?
Yep.
Great. Well, welcome to September office hours. Want to thank everybody for joining today. As always, we're recording for folks to have this available in the future on our HI website. And we'll have chat available for folks along the way if they have any questions or comments that they want to talk through. Can folks see the slide deck okay?
Yes.
Yes.
Okay, great. All right, so we'll get rolling then. So we'll get into the deck here. Policy and procedure as usual. We'll have some quality management performance updates, some children's program updates, touch on some trainings that'll be coming your way for the network, and some other stuff. Policy and procedure and upcoming policies. Jessica.
Hello, can you hear me?
Yes.
Okay, perfect. Today we are going over two updated policies, one new, referrals and assignments, health home serving children, HCBS service definitions, and necessity criteria, that is newer, and our health home serving children waiver and HCBS policy that has been updated. Upcoming policies, there are a few listed here. We do have quite a few that are upcoming. So those will start to get sprinkled in. So the next couple of months will be pretty policy heavy. And go to the next slide. So referrals and assignments, this was just an annual review. There were no policy changes to this. The only thing that was amended in this policy is that we added the desk guide for children's segments in MAP, because everyone is now putting their referrals into MAP. So this just kind of walked you through how to do it. It is the same directions that were in the slide deck when we walked through it on office hours. Does anyone have any questions on referrals and assignments? All right, you can go to the next slide. The health home serving children HCBS service definitions and necessity criteria policy that is about, I think, 50 something pages long. This is a brand new policy that was effective in June. I did send out the DOH version as interim guidance because it was going to take me a little while to go through it, find out what was applicable to just care managers versus everybody, including HCBS providers. So section 1 of this policy will walk through what is required when requesting, discussing, and delivering all services. So section 1 is applicable to every HCBS service. Then section 2 of this policy is going to walk you through in detail every single service that you would potentially refer for. So it's going to go over the definition of the service, what that service looks like, so those components, how is that service delivered, in what setting can that service be delivered, if there's any limits or exclusions to utilization, so how much can that service be administered, administration requirements, so what is required of that service when delivering that service, what is the necessary documentation required for that service, how to stay enrolled in that service, and how to discharge from that particular service. So the section 2 of this policy will walk through every single HCBS service. It will walk through all of those components. So this is very important for all of my children's care managers who have members who are enrolled in HCBS, or if you get a member who's enrolled in HCBS and you're going to be referring for services, you want to reference this policy. It will break down kind of what that policy is or what that service is intended for, how it's delivered. So this way you can make the most appropriate referrals and be able to talk to families about these services. In conjunction with this policy, there are going to be parent tip sheets. So right now we only have parent tip sheets for modifications and for assistive technology. Accompanying this policy is going to be tip sheets for every single service that you can give to the family. They're just not out by DOH yet, but as soon as they are, I will get those out to the network. Does anybody have any questions on this policy? All right, you can go to the next one.
Make sure you put some time aside. This one's a long one.
Yes, but you can just go to the service you need to review. You don't have to read the whole thing. The original one was about 75 pages, so I did cut out some material that was unnecessary. All right, you can go to the next one. Okay, so this is our Health Home Serving Children Waiver and HCBS policy. This was an annual review, although we did have some clarifications in there based on some memos that DOH has put out to all of us. Basically, what one of the changes that we have is just going over what the expectations are if a member you have referred for an HCBS service has been placed on the statewide wait list. If you have any member that you have referred for a service that has been placed on a statewide wait list, the expectation is that you are going in and kind of re-triggering that referral back to an agency to see if an agency can pick it up. Because once it's on that statewide wait list, wherever you referred it to kind of disappears, and they don't have that person on their radar anymore. That person's just kind of sitting out in the internet ether, just waiting to be picked up. So you want to go in and you want to re-trigger those referrals. The other thing to do is if you have a member who is enrolled in a managed care company and they've been placed on a statewide wait list, it's important that you're reaching out to that managed care company and saying, hey, I have Jane Doe. She lives in Warren County. She has been sitting on the HCBS waitlist for Prevoke services. She has been moved to the statewide waitlist multiple times. Can you help me? Because the MCOs do have a requirement to make sure that their members are receiving the services that they need. So you want to make sure that that communication is in your record. And just keep in mind that every single month, you should be monitoring this wait list, and it should be referenced in your notes that you are aware that your member is on a wait list, that your member is receiving a service, that your member X, Y, and Z when it comes to these HCBS services. We do look for that monthly communication. You can go to the next slide. Another thing that we wanted to put in writing in here is that we want to make sure that the notice of decision is completed every single time a level of care is completed. And you have to complete a level of care every 365 days. If you are 1 day late and you complete it on the 366th day, that K code will now automatically be removed from that member's file. So what was happening was people were completing these level of cares, they were coming out ineligible, or they just weren't doing the level of care. When I say people, I don't mean our network, because our network is perfect. This is just statewide. What was happening is people were not completing the level of care or doing it grossly late, or it's coming out ineligible, and no one was notifying capacity management. So there was this big push to clean up all of those K codes, and the cleanup was massive. Obviously, we were not the problem children, because I never emailed any of you to clean up any of your K codes because you're all perfect. However, the rest of state is not. So what they decided to do is they have now decided that every expired LOC on that 366th day, whether you tell capacity management or not, they are automatically going to remove the K codes from that member's file. So it's super important that if a member needs an annual level of care, that you are doing it on time to avoid getting that K code erroneously removed from that person's record. Another thing to talk about is SCD determination. So if you have the target population of SCD, it's super important that you have on file a copy of the evaluation that provider used to make the determination that that member meets SCD criteria, ideally within the past year. We all collectively know that all of our kids that are enrolled in some sort of service, that counselor, that provider, they are not completing this evaluation annually. they just don't do it. They can't bill for it annually. Ideally, it's within the last year. If it's not, we'll take the last one that they have completed on file, because that's going to support, hey, this provider says that this kid has this diagnosis and has these functional deficits. I'm the treating provider, and I also referenced this last evaluation. So you want to make sure that you have that on file. And as you send in your level of care requests to me to review, this is something that I'm looking for. Another thing that they're looking for, and you guys know this because I've started to be a little bit picky about determining multi-system involvement. When you are utilizing multi-system involvement for the SED population, we want to make sure that those multi-systems are in place to support that mental health need and that SED designation. So when I talk about your IEP classification, if you're going to use IEP as one of those multiple systems, that the classification on the IEP explicitly calls out that they are SED. So they're really cracking down to make sure that everything that that youth has in place is related back to their mental health, and that is what's supporting that SED target population. You can go to the next slide. For the medically fragile population, another thing to note is that you want to make sure that if you are using the medical fragile population for the target population, is that the condition or conditions that that member has are physically disabling or causing severe limitations within the past year or likely fatal. Not every single physical health condition will qualify a youth to be medically fragile. We want to keep in mind for all of our target populations that every single time we do a level of care, we are supporting the fact that that youth is at imminent risk of institutionalization or the need for very complex supports that, if are not in place, would result in hospitalization if they weren't there. So that's something that you want to keep in mind as you determine whether you are going to keep these folks enrolled in HCBS. I was just talking to one of our CMAs. They kind of have a youth who would meet multi-system. They do have all of the things in place to meet multi-system, and they do have SCD, but there's no ER visits in the last year. They have not applied for an out-of-home placement. So there's really nothing that's supporting the fact that they are at imminent risk of institutionalization. So in that case, they would not be eligible. Also, there is a whole fair hearing process. If you are going to deem someone ineligible, they can request a fair hearing. They can have aid to continue if they are receiving those supports. So that CMA and I had the discussion about like, okay, this is what's going to happen and that family's not going to be happy. This is what you can do to follow up with that family. If you know ahead of time that the youth that you are working with does not meet the risk factors, you do not have to complete that level of care. So you just want to keep that in mind, that not every single year is an annual level of care going to be due and completed. If you know going into it that that youth is not going to be eligible, that is a change from the past. In the past, they did want to see that ineligible LOC. You no longer have to do that. And then you can also make that determination in conjunction with the lead health home. If you don't feel comfortable making that determination by yourself, that's fine. We can walk through the documents together and then we can make that determination. The other thing now is that we do get paid that whopping $200 for your assessments. When you do your level of care. If you do it late and it's overdue, you are penalized and you do not get to collect your $200. So if you're really looking forward to that $200, make sure that your LOCs are done on time and you don't risk having those K codes removed. Does anybody have any questions on this?
They get those Benjamins.
Got to get that $200.
Right.
All right. No questions. I'm going to pass it over to, I don't know, Taylor maybe?
Thank you, Jessica.
Okay, just a couple of quality management and performance things to touch on. Everybody can hear me, right?
Yes,
Okay, perfect.
I
I
can.
didn't want to get through that whole spiel and then nobody can hear me. All right. So, quality notebooks. Most of our CMEs are pretty good about this, but I just wanted to bring to everyone's attention, please return your quality notebooks monthly, unless, of course, you have nothing on it. But if you do have anything that is a level one or a CAP item on that quality notebook, please make notes on that and send it back. That way we can double check, look into things, make sure everything has been resolved for the next month's notebooks. If there are things that you cannot get done, that's totally fine. It's understandable. But please write down what the barrier to completion is and what the plan is to rectify. And if you have a timeline in mind for when we can recheck that item to make sure that it's been resolved. And then for audit reviews, so for CMAs going through the comprehensive chart audit review process, those that have been through already in 2025 have got to work with the new reconciliation template sheet. It's a really nice Excel sheet that we provide you guys during the comprehensive chart audits where you guys can literally just mark down whatever question number it is that you want to refute or you have questions on. It'll auto-populate the question text in there. We're asking that those all get returned prior to the meeting with the health home. We've had a number of CMAs not get those back to us prior to the meeting. And it just makes the meeting a little bit less productive because we're unable to look into any of those refutes or questions that the CMA may have prior to meeting with you guys. So if you could make note when you're going through your comprehensive chart audit review to get those scoring tools and audit reconciliation templates back to us prior to the meeting, that would make the workflow a lot easier and make those meetings a bit more productive. Thanks, Travis. You can go to the next slide. And then I just wanted to also touch on the EOPs or enhanced oversight plans. We've had a number of emails come through because we have had a number of CMAs fall onto these enhanced oversight plans. As you guys know, we rolled these out in 2025. And they're basically a way for us to mark the performance of CMAs for our biannual process audits. So you've probably seen them come through for consents, care transitions, things like that. This is our metric and our way to track those items. It is not meant to be punitive in nature at all. So I just want to let everybody know that it's not something that we report out to the state. It's just basically an internal measure that we are holding, and we're making our basically what it is to do is to make the CMAs aware that this is an area of deficiency that we've noticed through the audit. We want to make you guys aware of it, that we want you to be looking at it in the coming 90 days when the EOP starts, and then we will re-audit that specific process audit once that 90 days has come to completion. So it's not meant to be punitive in any way. Again, we just kind of send out this enhanced oversight plan to let you guys know that we have noticed this deficiency. We don't require that you do any additional training or anything like that, but if it is something that you guys would like, we are always open to hosting additional trainings or providing you additional guidance on that specific area where you've landed on the enhanced oversight plan. The threshold is a 90%, which is very, very high, but that is a threshold that we as a health home are held to by the state. So it's therefore passed on to you guys as the CMA. And when we go through redesignation, basically every question on that comprehensive chart audit that you guys have on the DOH version, if we fell below a 90% as a health home on that, then we have to write an enhanced oversight plan for that specific area. So that's why we've developed it to be this way. We do understand that is a bit of a high threshold. We will be looking to potentially beef up the amount of charts that we look at per month in 2026. But as you guys know, we are pretty light staffed on the lead side right now. So hopefully moving forward, we will be able to look at a little bit of a larger population to make it so it's a little bit more of a robust sample size. But for right now, just know that it is just something that we want you guys to be aware of, that we found the deficiency in, and take note to look at that specific area over the course of the 90 days of the EOP. We will re-audit a fresh population and try to get you guys off of that as soon as possible. Thanks, Travis.
All right, thank you, Taylor. Any questions or comments from anybody on any of the quality management stuff that Taylor touched on? Okay, well, that leads into the redesignation. All that stuff is in preparation so that we can be proactive for when redesignation comes, which we're headed into, as I mentioned last month. We're going to be hit up on our children's redesignation. So our quality program helps prepare us for when redesignation comes. And we are on the brink of one in November. As I mentioned last month, we actually just got our interest packet yesterday from the Department of Health. We were able to get our SINs for the sample that's going to be pulled, which we almost fell off our seats yesterday when we received them. So for those lucky care management organizations that had SINs selected, we will be getting those out to you in the coming days shortly. And we ask that when we get those to you, that you go through and audit those particular charts. We will be also auditing those charts on the lead side and sending our results to you from our audit of those charts and asking for response from our results and get the feedback from you on our responses as well. So we ask for collaboration on that and partnership so that we can have this tight turnaround that we're going to have in the coming weeks to get ready for this redesignation. It's going to be fast and furious, of course, as always with anything with the Department of Health. And, so it's going to be a busy few weeks. We have to, in this time frame for our interest packet, which is due by October 20th on the lead side, basically justify our quality program once again and everything that we do and support it, which Taylor just touched on a couple examples. We have to prove what we do as a lead to support our network and what we do for everything quality and compliance, what we do for everything around policy, procedure, the types of quality processes we put in place, the types of trainings and supports. What do we do as a network to provide those to you in, the types of things such as data den, the metrics that we put forward. We have to show all that proof and support and put that to the state and then basically justify what do we do as a health home. And then they'll assess that and ultimately grade us on that. So we'll be pulling that all together and putting that proof, if you will, to them in the next couple weeks. So we're going to be pretty busy doing that. And then they will be auditing those charts from those SINs pulled in the coming weeks as they go through the month of November. So we ask that folks just do their due diligence and getting everything together and thoroughly going through those in the coming days. And there will be also, once the audit time frame comes through, reaching out to supervisors for each of those organizations and basically doing a survey to you, asking how your interactions with the lead are and what your thoughts are about the lead. So that'll be your opportunity to provide feedback. So you'll have a chance to put your thoughts forward about improvement, things that are working well, things that you think have opportunity for improvement, things in general for comments, etc. So that's always a nice room for feedback for you as well. So we welcome that as well too. That's how we get better. And we also get scored on our metrics, how we're doing as a region for children's in this area as well. Over the last couple of years since our last redesignation, what are those gaps looking like? How have we closed them? So that information will come through at the end of this review. So a lot of information is going to be coming through in the next month or so. We'll get that out to you as we know more. So I didn't know if there's any questions at this juncture, but that's where we're at as far as redesignation is coming. And we'll get you more as we get more. All right, stay tuned. Jessica, back to you.
Alrighty. Just to go back to everyone's favorite topic, children and HCBS, I did just want to go over a couple of quick reminders that everyone should keep track of when their level of cares are due and start working on that paperwork up to 2 months prior to the expiration of the current LLC. Do not rely on me to make sure that I'm saying like, hey, remember this person's LLC is due, because I'm not always timely with that. So please make sure you're aware of everyone's level of care due date and then start collecting that paperwork, because sometimes it can be difficult to collect depending on the target population. Another thing is, please make sure that you are submitting all of that paperwork to the health home so we can review it to make sure it's accurate and you have everything you need before you do that level of care. If you collect one wrong thing or you're missing something and you go do to that level of care, then everything you have done is wrong. So we'd like to have multiple checks and balances. That's that supervisory sign-off sheet. So the care manager collects the documentation, supervisor reviews it, signs off on it, and then that gets sent to the lead health home. Someone at the lead health home will review that documentation and say, yes, go ahead, or no, you're missing this. So please make sure that is being done. The other thing to keep in mind is anytime you discharge somebody from HCBS, please let the health home know. We will reach out to capacity management for you. You do not have to reach out to capacity management at all. You just let me know, the health home know that you're going to be discharging someone. This way we can kind of look over to make sure everything is appropriate. Make sure that everything discharge wise is correct, because you also have to keep in mind we have some of those kids that have those KK codes. So when it comes to discharge, things can get kind of messy. So please notify the health home and we will take care of notifying capacity management. Does anybody have any questions on this slide or anything related to kiddos and HCBS? Alrighty.
All right. Here's some trainings that are coming up just in general in the next month or so. The next series for the MVP, we had one come by a couple of weeks ago. The last one's coming up on the 29th of September for their annual education presentation for Health Home CMA. So folks who didn't get to catch the prior one, there's another opportunity September 29th, 2 o'clock to 3:30. There's an IRMS webinar October 20th. That date changed. I think it was September 26th. That changed to October 20th at 1 p.m. And then there's an HHSA Plan of Care overview, Jessica, October 6th, 10:30 a.m. For folks that are interested for that overview. That's what's on the docket that's coming forward. Anything along those lines, Jessica, you wanted to mention that I have not?
No, just I resent out the notification about the IRAMS webinar this morning. So it was originally scheduled for the 24th. It's been pushed out to the 20th. If you are actively serving anybody who is HCBS, or if your CMA serves the HCBS population, even if you don't have anyone active right now, you are all strongly encouraged to attend that webinar. And then the one on the 6th, that's just us walking through that quarterly overview of the adult plan of care. It's not going to differ too much from any presentation in the past going over the adult plan of care, but everyone is welcome to come. Please forward the invitation to your staff, any new staff that want to come, but it will be pretty similar to stuff that we've done in the past. So it is not required for anyone to attend.
All right, thank you, Jess. And that was all on our end. Is there anything that anybody wanted to discuss, talk about?
This is Jeff from Saratoga Hospital. Is there received any guidance at all on how we bill in regards to the waiver, so as not to duplicate billing and services?
in regards to the waiver, in regards to which waiver, Jeff? The
The
SCN waiver
the 1115 waiver?
or the Social Care Network?
Yes. But like
Clear
there's some,
guidelines specific for health home versus the SCN waiver. I haven't gotten anything clear fully. We've got some recommendations through the coalition. We could get that out to folks. I know they were working on some stuff to get clear through DOH, but that hasn't come through yet as far as their final regulatory thing.
okay. But obviously that's something you'll keep us updated on.
Yes, of course.
Okay, thank you.
Yes. Any other questions? All right, well, thank you as always for everything you all do, and I hope you have a good afternoon. Take care, everybody.
You too. Thank you.
Thank you, everybody.